everyone. Today I'm going to introduce you to Tina Chrysochou, who is a consultant nephrologist at Salford Royal Hospital NHS Foundation Trust. And she is also Honorary Senior Lecturer in Cardiovascular Sciences at University of Manchester. Hello, Tina. Thank you for joining us today.
Thank you, Karen. It's an absolute honor to be here today.
That's great. Today you're going to talk to us about Fibromuscular Dysplasia, or FMD for short. Firstly, can you give me a brief explanation of what FMD is?
So yes, sure. Before I start, I just want to start by saying congratulations on this wonderful meeting and all the hard work that you and all the Beat SCAD team put in behind the scenes to enable meetings like this, which enable two-way conversation, because I often learn just as much from these meetings from the patient perspective as I'm sure it's the other way around. So to answer your question about FMD, FMD is still considered a rare disease which affects the blood vessels of the body. And what happens is that there is abnormal growth within the blood vessels that results in narrowed segments called stenosis and ballooned segments called aneurysms. This occurs more commonly in the kidney and the neck arteries, but can affect any of the arteries within the body. There is still so much to learn about FMD, and that's why there are all these initiatives to try and plug into the existing registries, to try and also have a UK contribution so that we can learn more about the condition. FMD can be completely asymptomatic in many individuals, and we often have patients presenting where it's been detected incidentally. For example, if you come forward as a live donor. So you have the one spectrum where it's completely asymptomatic and it's not going to bother you at all. And then we have the spectrum all the way through to where it can present with high blood pressure, but then as much as strokes, kidney impairment, heart attacks. So there can be the full spectrum on how it affects your blood vessels. And as a consequence, FMD can be innocent, as I've said in some cases, but can be a lot more serious in other cases. It can lead to investigations such as angiograms, radiological scans to try and detect it, and then procedures such as angioplasty. So that's FMD in a nutshell. We still don't know the exact cause. We know that it's more common in females. We know it's more common in young females, but it can certainly present in men as well. It can sometimes be more serious in men. But there's still a lot to learn about FMD.
Thank you, Tina. And are there any new developments in FMD research?
So the most knowledge we've been able to ascertain has been from the registry. So the American registry and the European registry are a valuable resource and have recruited now thousands of patients to help us try and understand a bit more. At the moment, the only research developments are still very much in the research realm. There isn't anything that's clinically relevant right now. In terms of the best resource to find out what is of expert opinion and of high value in clinical use, the best resource is the International Consensus document, which was published in 2019 with Professor Alexander Persu and Professor Heather Gornick as the first authors. This is widely accessible, so you can ask your health professional to consult this. It's been published in the Journal of Vascular Medicine and Journal of Hypertension, but that is the best resource to look at the latest updates. And in this document, it presents very much what we know about who to screen for FMD, when you should be considering if it involves family members or not, what the best tests are to do. So for example, a CT angiography and MR angiography. So this document is really a valuable resource in terms of understanding what is clinically relevant. As regarding, your question really was more about research. So at the moment, there is a big drive to try and understand and unravel if there is a genetic component to all of this. And the latest research has suggested some susceptibility genes. So I'm sure at some point in the course of today, you will hear from Professor David Adlam about the factor 1 susceptibility gene. This is quite a widely seen gene, and the abnormalities within this gene are also quite widely spread in the general population. So unfortunately, we can't really use that as a diagnostic test in FMD at all. It's still very much in the research realm. And ultimately, it's probably going to be a a constellation of potentially some genetic factors and phenotypic and factors that affect us in our lives as well, that might result in FMD, as well as who has a more serious form. We do know that smokers tend to have more severe manifestations of FMD. There are still questions about the oral contraceptive pill, hormone replacement therapy. At the moment, we are just suggesting a risk-benefit analysis. It's a very individual decision about that. But if there aren't any real benefits confirmed from being on the pill or hormone replacement therapy, we'd probably advise to come off it. So to answer your question again, we're trying to unravel a bit more about who might get a more serious type of FMD and any genetic susceptibility, if there is, from that. In the States, they're also looking at genomics to try and understand whether there might in future be a blood test that might come available for FMD, which be phenomenally useful. That's still very much in the research realm, and these research developments take years sometimes to not only come to life, but also to be validated as being useful in the general population rather than just a research smaller population.
Thank you. That's really interesting, Tina. So what about a UK FMD registry? Can you tell us a bit more about what's happening there?
Yes. So for a number of years, I've been phenomenally keen that we also have a UK contribution to all the amazing work taking place on an international scale. It has been a very long process to get to this point. It's a lot easier said than done. But my intention was always to look at this as from a national approach rather than just looking at my own centre. And I think that's why it has been so challenging, is because to try and get a sort of a national response is a little bit more tricky. So the latest information there is, we would like to join the FAIRY initiative. So FEIRI, that's the name for the European FMD registry. They are well developed. They have got a phenomenal support structure, statistical support, and it's already so sort of robust and advanced. It makes no sense for us to set up on our own independent mission. So we would like to collaborate with and join the FAIRY initiative. So to do that, we would like to have a UK study that will be exactly the same as the European initiative, and we will upload all our data to their portal. To try and get this adopted on a national basis, I am trying to get something called portfolio status, which with some funding that we've very kindly secured from the British and Irish Hypertensive Society, we're using that towards getting this adopted on the national portfolio. What does that mean? If something is portfolio adopted, it means that you can immediately access research nurse support in centres across the country, which again is very useful from a practical perspective, because if you're simply relying on the goodwill without any funding and without any time from busy clinicians, my fear is that that will be a non-starter. So by being portfolio adopted, it's got a better branding to it, and it also means that we access the resources to upload into this portal. So Salford Royal Hospital, under the umbrella of the Northern Care Alliance, because we're now part of an alliance with Pennine Acute Trust, has agreed to be the sponsor for the study. And we have gone through all the paperwork with them, and they are happy to support us. So Salford Royal will be the centre from which all the research is coordinated. But each individual centre, once we finally have ethical approval for this, each individual centre will be responsible for their own data collection and uploading into the portal. So to be part of the FAIRY initiative is essentially just uploading patient information, of course, anonymously, into the FAIRY portal. And then it's optional as to whether centres want to have serum and biobanking collection and DNA collection. We are making provision at Salford Royal for centres to send their DNA and serum to us if they would like, but Professor Chrysochou is more than happy for centres to directly send it to them. And in fact, that is something he's put into the FAIRY initiative, which is now an international study, that centres can just directly send their samples to him. But we are making provision for this at Salford Royal in the event centres perhaps only have 1 or 2 samples that they don't, it's difficult or costly to send to Europe. So I've given you a very long, convoluted answer because there's been about 3 years of work that's gone in behind the scenes. But we have the first step, which is Salford being the sponsor. The second step is now to get ethical approval. And because we're also looking to recruit both children and adults, again, there's another layer of complication there, because we have to make sure that our information leaflets, for example, are age appropriate, that we have thought of all the ethical considerations across the spectrum. So yes, so hopefully I will have good news for you once we have ethical approval. And once we have ethical approval, we can roll this out to all centres across the UK, and anyone from across the UK and Ireland can be have their data uploaded to be part of this collaborative.
So, have you any idea how many centres across the country there might be in the future?
So we have at least 8 centres who have shown interest in FMD and have got patients with this condition. But if I look at my FMD clinic, for example, I'm receiving patients from all across the country. So clearly it's something that is everywhere, but not everywhere has a specialist interest in it. But there are about 8 large centres who would be keen and have shown willing to be part of this initiative once it's approved.
Thank you. That's really interesting and very, very exciting for us living in the UK. If somebody is interested in joining the registry, who can get involved to start with, and how do they get involved?
So excellent question. So anybody with FMD, anywhere in the body, whether it be a carotid or whether it be renal, as long as you have FMD, you're eligible to be part of the FAIRY initiative. We're also including middle aortic syndrome, which is a subset of FMD. And Professor Chrysochou is also keen to consider enrolling patients who have aneurysms and dissections, but without the formal diagnosis of FMD. So that's something to come. But I'd be very keen, because I'm seeing a lot of that as well. So hopefully we can expand the remit. But at present, it's anybody with FMD anywhere. How to physically get involved would be your centre would need to upload your data to the FAIRY portal. And we can only really give them the link and the approval once we have the ethical approval for that. But it's essentially just a website. You log in, you have encrypted patient data, etc. So as long as they inform their clinicians, or the research team, the research nurses and the research team can upload your data.
Okay, so have you any idea how long it's going to be before you can start recruiting?
So it takes 6 weeks, I've been told at present, roughly, to get ethical approval. This week, we had our submissions sent back to us because they would like more questions answered specifically about the age-appropriate consent forms. And they've asked a few other technical questions. So I'd like to hope that once we can align our paperwork with the new patient consent forms coming from the European team, which will be next week, is my understanding, we can hopefully submit that once again back to the ethical committee then. So I'm going to estimate hopefully 2 months would be a good time before we can expect to have ethical approval. It takes very long. I've come to realize it's a long and arduous process, and I can only apologize it's taken so long, but there is will and there is willing. We just have to, obviously with Brexit and the UK has very strict regulations when it comes to research. And because we've chosen the harder step of trying to look at this from a national perspective rather than just my centre, there are a lot more steps involved.
Yes, I can imagine. I've been involved with a bit of research myself, and I understand how complicated ethics approval is in the UK especially. Once you've got approval, how long do you think the registry will be running?
Right, so the registry is available for 10 years. You always have to state how long your study is running for. And we've again just copied what the Europeans have done. So they have stated that the research is to run for either 10 years or until 5,000 patients are recruited. At that stage, depending on recruitment and whether you feel that there are still patients to be taken on board, you can apply for an amendment to extend that. But ethics committees and research teams always need you to have a finite time. So it's either the first 5,000 patients across Europe, which we will be part of, or 10 years. In the UK, we're starting with a target of 200 patients. And once we achieve that and we know how long that will take to achieve, we can then apply for an amendment. When we looked at the RADAR database, so you may recall from previous meetings that I managed to get FMD adopted as a rare condition on the RADAR registry, which is a UK rare disease registry. all that involved was uploading patients to this registry, which means that in future, if any research or studies came available, then you consent to being contacted about that. And that involved very little work from the medical team. There was very little involved to being part of RADAR. And yet, despite being on RADAR for about 6 years, we've only had around 40 patients uploaded to that, the vast majority from my center. So again, we've just put 200 to have a realistic target, and then we can obviously expand that once we hit the target.
Okay, I've just thought of a question associated with that, Tina, and that is, if somebody listening to this talk who has been diagnosed with FMD, can they go back to their consultant or their GP and ask to be registered with RADAR?
Yes, so it tends to be through the hospitals. That will be a lot easier because it's the hospitals that benefit from research nurse support. And because filling in the online portal will take some time, and there also needs to be an annual follow-up questionnaire, etc., it's best that you're in a center that can support that going forward. So it's unlikely at present that GPs would be able to do that, I suspect, because of time constraints. But yes, the hospital consultant can do that. Alternatively, if you're a patient who's been referred to our center, we will then obviously be able to upload your data.
It's all been really useful and interesting. I'm sure there'll be lots and lots of questions about FMD from our audience. Finally, just to cover a little bit about where and how people can access specialist FMD advice in the UK.
So on this front, I've got a lot more practical and positive news. So you will recall our UK and Ireland First Patient Information Day in November 2019. And at that meeting, there was an appetite to have a specialist centre for FMD. So using that impetus, we set up the first FMD clinic at Salford Royal Hospital. And that was set up in around about February 2020. So it's been running for about 18 months. And this clinic is continuing to go from strength to strength. So if you are referred to the FMD clinic, you have the opportunity to speak to myself from a general and a renal FMD perspective, and now a neurologist, Dr. Jane Malloy, who will provide expertise from the neurological FMD perspective. We also have 2 multidisciplinary team meetings per month. The one is a renovascular MDT with an interventional radiologist and a group of experts, where we will discuss and review all your films and then decide on appropriate management. And similarly, we have a neurovascular MDT. So that's one of the benefits of this clinic, that there is very good communication from that perspective. And as a consequence, the clinic has grown so much so that there's currently a 4-month waiting list, and I'm going to look at establishing more capacity. But I've seen patients from all across the country come to this clinic, and it just gives me the opportunity to consider your case on an individual basis and provide patient information on an individual basis, answer your questions in as practical a way as possible, bearing in mind the limitations to what knowledge is out there. I can also signpost you to relevant resources. We also discuss on an individual basis whether your care will continue purely under our clinic, or whether there is a local neurologist or a local team for various complications of FMD, for example, that might be better to follow up with. Just some experience that I've gained over the last 18 months is that sometimes it's not always FMD. And again, this has been tricky, in particular some patients' cases where everything looks like it should be FMD, but they don't have the hallmark stenosis, for example, the narrowed blood vessels, but they have some of the other features. So that's something that we look at really carefully in our MDTs, is do you fulfill the criteria for diagnosis of FMD at present? Another commonly requested theme is about genetic testing. And genetic testing isn't of value to the vast majority of patients who come to the clinic, because there isn't a genetic test for FMD. But in the rare case where we feel you need a connective tissue disorder genetic screen, we will refer you to your local centre. We don't have an actual genetics clinic at Salford Royal. And then the third question that I've seen quite commonly over the last year has been related to COVID and the pandemic, because patients have wondered whether they fall into the clinically extremely vulnerable group, for example. But having FMD, it does not affect your immune system as such. So it does not classify you as a clinically extremely vulnerable patient. So that's been valuable for some patients to be aware of. So we're learning all the time, and it's been something I'm very passionate about, and I learn a lot from the patients. And at least you have that comfort that there is a clinic somewhere in the UK that has a lot of passion and knowledge about FMD. And as I said, as long as there's a referral from your local specialist and we can get your films transferred across to us, we're more than happy to see you.
Thank you. Just one question that occurs to me is, what is your experience of people that have had a SCAD and then get diagnosed with FMD? And what sort of proportion of the patients you've come across are SCAD patients?
Yes, the minority is the answer to that, Karen. So of the patients that have come to the FMD clinic, there's probably around 5% have had SCAD. And that's either SCAD with FMD or SCAD on its own. And we've been able at least to do full body imaging to rule out FMD elsewhere. Any patient with SCAD, naturally we signpost to the SCAD registry and ensure that their specialist either has consulted with Professor Adlam, or if they're not experienced with managing it, at least are signposted in that direction. So it depends. I would say that most of my patients with SCAD are very well informed patients, and they are a very dynamic group. So hopefully will be a valuable addition to your forum. And it's a pleasure to be with patients who are sort of as keen as what we are to get to the bottom of what's caused it, or how any information we can gain from research in the future.
Lovely, thank you, Tina. That's been really, really helpful. I'm sure everybody's really appreciated hearing about FMD in a bit more detail, and I'm sure there will be questions which I will be forwarding to you, and we will also try and add a bit of information into our next follow-up of the day or our newsletter with a bit more information as it comes to us about the FMD registry. Thank you very much.
Thank you for the opportunity.